Good morning. Good morning to you. I'm Paul Irwin, Dean of the School of Public Health here at UAB, and I want to welcome all of you to the 2025 Jefferson County Department of Health's State of the County's Health presentation. Thank you to everyone who is joining us in person and to those joining virtually via Zoom. I'd like to take a moment to recognize a few of our distinguished guests in the audience. I would like to acknowledge the elected officials present who had RSVP'd. If you're here, please stand and let us acknowledge your presence. Counselor Carol Clark, Commissioner LaShonda Scales, and Counselor Wardine Alexander. Are you in the room? You will be. Next, I would like to recognize current and former health and deputy health officers. Please stand when I call your name. It's Dr. Scott Harris. Are you here yet, Scott? Dr. Mark Wilson. He's coming. I heard from him this morning that he's on his way. Dr. Dobbs. Dr. Claude Ouimet. Thank you. Lastly, if you are a current or former JCDH employee or retiree, please stand and let us acknowledge you. We greatly appreciate all that you have contributed to Jefferson County and the state of Alabama. For the past several years, the UAB School of Public Health has hosted the Jefferson County Department of Health in their annual State of the County event as part of National Public Health Week, and we are thrilled to continue this tradition. The theme for this year's National Public Health Week is "It Starts Here." For 3 decades, National Public Health Week has played a key role in advancing access to health care, improving community well-being, and promoting health for all. As we celebrate this milestone, I encourage you to take a moment to reflect on the incredible progress of the past 30 years and consider the path ahead. When I reflect on the successes in public health over the past 3 decades, several stand out, including the end of indoor smoking, the expansion of health insurance coverage for low-income Americans, and the development of the COVID vaccine in record time. I also want to remind you to consider not only the achievements that protect public health, but also the dedicated individuals on the front lines and behind the scenes who work tirelessly to prevent disease, promote wellness, and protect vulnerable populations. We are grateful to all of you for what you do. And now I would like to introduce today's speaker, Dr. David Hicks. Dr. Hicks is a board-certified family medicine physician and serves as the health officer at the Jefferson County Department of Health. At JCDH, he also served as deputy health officer and incident commander for JCDH's COVID-19 response efforts, and was medical director of adult health and family planning. Before working at the health department, Dr. Hicks oversaw 5 clinic locations as chief medical officer at Birmingham Healthcare. He has also provided medical care in various settings, including urgent care clinics, correctional facilities, and an academic health system. He is a fellow of the American Academy of Family Physicians and a member of Alabama's Rural Medical Service Awards Advisory Board. Dr. Hicks is a Leadership Birmingham graduate, former chairman of Alabama's STD Medical Advisory Council, Freshwater Land Trust Red Rock Committee member, Kiwanis Club of Birmingham member, and UAB School of Public Health's Community Engagement Council associate. In 2021, he received the NAACP Metro Birmingham Branch's Community Trailblazer Award. In 2024, he earned the Medical Association of the State of Alabama's William Henry Sanders Award. Dr. Hicks earned a Master of Public Health degree in Behavioral and Community Health Sciences at the University of Pittsburgh Graduate School of Public Health and was a National Institutes of Health Fogarty Research Trainee at the Minority International Research Training Program at the National University of Science and Technology in Bulawayo, Zimbabwe. He later earned his Doctor of Osteopathic Medicine degree from Rowan Virtua School of Osteopathic Medicine and completed his family medicine residency at Christiana Healthcare Health System, where he also served as chief resident. I'm very honored to introduce him today and welcome him to UAB's campus as a part of National Public Health Week. Please join me in welcoming Dr. David Hicks. Thank you, David.
Thank you, Dr. Irwin, and to the UAB School of Public Health family. You've been gracious to host this talk for many years, and I really, really appreciate the collaboration that we've had. When you talk about the state of public health in Jefferson County, that's a very broad way of looking at things, a lot of factors that we have to look into. And there's a couple ways you can look at that. All right. For one, if you look at national organizations that look at the overall health of a community, we have county health rankings. And county health rankings are kind of compiled by the Robert Wood Johnson Foundation as just one marker of the kind of general health status of a community. And then the U.S. News and World Reports also has something called Healthy Communities. And they evaluate counties and kind of a broad set of variables. And so I think that from an objective perspective, it gives us a snapshot into an overall impression of the state of the health of our community. And I'm going to kind of walk you through some of this right now. So every year, these rankings come out, and this is the latest rankings. And as you can see, is that what they say is that Jefferson County, Alabama, is faring about the same as the average county in the United States of America, and that's talking about health outcomes. And when we say health outcomes, these are things like if any of us are going to develop, say, diabetes or cancer, heart disease in our community, those are the outcomes. Now, there's some factors underlying that, but looking at the overall outcomes, we're a little bit better than the state average, but we have opportunities certainly to improve upon. So here's a few examples of the health outcomes that they are actually evaluating us on, right? And I will highlight a few that I think that are fairly notable. Certainly those that live in Jefferson County, I think that certain things will resonate with you. So premature death. All right. And if you look at premature deaths in Jefferson County relative to the rest of the state and the rest of the country, we have an excessive amount of premature deaths. Now, when we talk about premature deaths, that is homicides. So our community is more burdened with homicides relative to other parts of the state, and certainly worse than other parts of the country. And then they have quality of life measures as well. And so this is based on surveys that they do generally across the country. And when you ask Jefferson County residents, how do you evaluate your mental health? They ask, do you have poor mental health days? And if you see in Jefferson County and across the state, we're saying that our mental health is actually worse if you look at that compared to the whole of the United States of America, at least a typical county in America. And then low birth weight. So Low birth weight, you see the percentages, you see 11% in Jefferson County versus in Alabama 10%, and in the United States overall 8%. And low birth weight, just one point, is that is related to infant mortality, and I'm going to talk about that in a little bit, but that's certainly a challenge here, and certainly there's underlying reasons for that as well. Now, there's other health outcomes, right? And there's a litany of those, and there's a few more I want to highlight here, okay? And so, as you can see, life expectancy. So, if anybody in this room is age 73 or above, congratulations. You beat the odds in Jefferson County, all right? But what about the rest of us? And why is this the case? And these are all related. So if you look at life expectancy, we're not living as long as we really should be relative to other counties in Alabama, and certainly relative to the rest of the United States of America. And then underlying that, you see some other related data points. Age-adjusted mortality. We have premature deaths. We're dying prematurely. And then you see child mortality and you see infant mortality. So when you look at the life expectancy, what's driving down the life expectancy numbers in our county are two main drivers. It's the homicides that are impacting our young people, and also opioid overdose deaths. And I'll show you some data about that later. And then infant mortality, again, that's something that we've been dealing with for as long as we've been in existence in our county. So this is just a national stubborn issue with just really underlying challenges. And then you see HIV prevalence, and it's just not, they're evaluating about HIV prevalence, but HIV is not the only sexually transmitted infection, but certainly you look at other sexually transmitted infections in Jefferson County, and we're seeing significantly higher rates here, and there's a multitude of factors for that. So they go on to look at us, and I talked about outcomes at the onset, and now this is talking about health factors. I'm thinking about this, about risk factors. What puts us at risk? What puts us at risk of having the poor health outcomes? Now, if you look at these numbers, and if you ran this report, say, last year, and then you look at this year, we've kind of moved up a notch in the positive direction. And so Jefferson County is beating the national average and the state average on health factors, and I'll show you what some of those factors are. So, there is some hope here. A myriad of health factors, as you can see. Again, I will highlight a few, and I did this last year as well. I want to look at this. Now, the first box, you see obesity, you see physical activity, you see access to exercise opportunities. So, exercise opportunities. Question for the audience. How many of you, perhaps in the past 3 months, or let's say 6 months, because it's been cold outside, have actually gone on at a park or a trail close to your community? Show of hands. So if I'm right about this, we're talking about 80-something% of the audience in this room has done that. Now, as you can see, it says access to exercise opportunities. So access, we're beating the state numbers and the national numbers on access. Why is access so great here? It's because there has been investment to ensuring access. So this is a bright spot, right? And this comes from leadership of my predecessors, Dr. Mark Wilson, and a team of community partners that were working to put the infrastructure in place to make sure you have access, so that if you want to go into a safe space outdoors, you can do that ideally within a mile of where you live. But we still have a high number of obesity numbers in the adult population, and we have a relatively more physical inactivity. So we can't only focus on access. We have to now link people that aren't accessing the amenities that we have built and are continuing to build, and ensure that they're utilizing these resources, right? So it starts, you build the infrastructure, and that's what we've been doing. How do we get people, and the people that need to be on these trails and in these green spaces there? So it's a different level of engagement we have to do as well, right? So there's always work to do in public health. And then, ideally, we start seeing improvements in obesity and other things as well. At the bottom, I have teen births, and we're actually faring better in Jefferson County relative to the rest of the state in teen births. Certainly, there's opportunities there. I would like to give a shout out to our family planning program at the health department, right? We've been doing family planning at the health department since the late 1960s, and what the family planning program does is provide education, irrespective of your age. If you're, you potentially are a child of bearing potential, we're going to educate you about making sure you know what are the resources available to you, help you think about the decisions you're making, about spacing of pregnancies. Is this the right time? Do you need contraception or not? And so this is not just a victory for, say, Jefferson County Department of Health, but it's collectively as a society and in a group, we've done the investments, and we're seeing that we've made some progress, but we still have a ways to go as well. There's socioeconomic factors, and the one I'm going to highlight here, you see at the very bottom, is injury deaths. And you see that's an excessive number of injury deaths relative to the Alabama and the rest of the state. So what is injury deaths? These are the overdoses, the opioid, fentanyl crisis, and the overdoses, and that's showing up in these national numbers. So I don't think that there's anything here that's shocking that people don't know or have heard about. Now, that's the county health rankings from the Robert Wood Johnson Foundation. I'm going to pivot to the Healthiest Communities scoring, and this is from another organization, and they have different factors. Now, they assess 3,000 counties across the country, and they have 89 metrics that they look at. Now, if you look at last year, the score that Jefferson County had was a 43, and then we've improved up to a 46 this last cycle. And you see there's lots of different factors here. I'm going to highlight a couple where I believe that we have opportunities to improve. So you see equity, environment, and public safety, which we're not getting the highest marks on, right? And as I'm saying these things, when I'm talking about public health is not about just strictly medical. Public health is a broad definition of all the factors that impact all of our health. And so I want to drill down a little bit more into some of these. So when you look at the equity, as far as what they look at, I just want to say on the onset, when you hear the term equity, when I say health equity, that is a concept of fairness. Okay? We have to recognize that there are parts of our community or individuals in our community that need a different constellation of resources to be the healthiest version of themselves. What works in rural Jefferson County may not be the same as urban Jefferson County. People have different levels of physical ability. So equity is a recognition that you have to fit the resources to whom we're all serving, right? So as they're looking at equity, just think about that. Now, there's some people in the audience that I think are somewhat younger than me, and if you don't understand the term equity, the way I'm saying it, all it is, and I talk about fairness, is you living your best life. We want everybody to live their best life. That's equity, okay? Now, when they look at equity, there's different things that go into equity, at least from this scoring system. They look at income, education, health. Those are kind of underlying these criteria. And what they're acknowledging is there are disparities in educational attainment in Jefferson County depending on different subgroups of populations, okay? You see they have a premature death disparity index. We've talked about premature deaths and what that means. So again, in this assessment, again, there's different groups that are bearing the burden disproportionately on premature deaths, right? It could be overdose deaths from drugs. It could be homicide deaths. So there's opportunities here to give everyone the fairest opportunity to be the healthiest version of themselves, okay? Another category is environment, okay? And so environment, there's things that are controllable or modifiable by us, and some things are out of our control, okay? And so one of the variables they looked at under environment, and I don't know if anybody knows about, FEMA is an agency, a federal agency. They have a national risk index score. And some of the variables they looked at is, what's the risk in our community of heat waves? What's the risk in our community of tornadoes? What's the risk in our community of flooding? So some of those things, a lot of those things are unmodifiable right now, but because of the geographic area we live in, there's more environmental risk, things that perhaps aren't out of our direct or immediate control, okay? And there's some things that are human caused. So a month ago in Jefferson County, the first time in about 20 years, we had a code red air quality alert. I don't know if y'all remember that. Okay, one day. And why did we have that air quality alert? Well, in the Bankhead National Forest, there was a controlled burn by the U.S. Forest Service. And this is in Winston County and kind of Lawrence County. And that when the controlled burn, it was for a good reason, but that air through the winds traveled and came down into Jefferson County. So things that we can't control still impact our quality of life. And so that's just one example. And so certain things we just have to keep vigilance on and then see if there's anything that we as a community and society can modify. Now, if you see on this, it says population within a half a mile of a park. And that, again, is a bright spot. We access to parks, again, trails, green spaces. We're doing a phenomenal job here in our local community. And then there's public safety. Okay, and you're hearing some repeated themes. So under public safety, they look at our property crime and violent crime rates and opioid overdoses. And we're seeing that, of course, we're burdened with that higher than the national average. So that's why that public safety number is where it's at. All right. So the data I'm showing here comes from the Jefferson County Coroner's and Medical Examiner's Office. And just a caveat, this is about homicides, the trend in homicides over time since the year 2000. Now these are the cases that the Coroner and Medical Examiner's Office had a direct involvement in as they did autopsy investigations in. So this is not the full universe of all homicides, but you can see the trends. We know that in the past several years, the homicides have gone up. As you can see in the past 2 years, at least the cases that the Medical Examiner's Office has been directly involved with, there may be some stability happening from the ones they're dealing with. I think we all were pleased when we saw some recent reports by the local news that in the first quarter of this year, at least in the city of Birmingham, it appears to be a 50% reduction in the homicides. We hope that that trend continues, but certainly we have a lot of challenges there. Now, again, this is the Coroner's Office, Medical Examiner's Office looking at data. This is the most recent trends, and this is overdoses, drug or overdoses in our community by the means of death. What caused that? So drug poisoning is that blue bar. So that's been relatively steady over time. But you see that big spike in red. That's the opioid overdoses in our community. And as you can see, in this last year, we're seeing a significant decline in overdoses in our overdose deaths in our community. So there is progress. And it's a mixed bag here, right? So there are challenges that we certainly have, but there's also things that we're beginning to see some movement on a needle on. I will say, how do you get a drop in these numbers? And sometimes people ask the questions, what do we attribute that to? And it's a multifaceted kind of answer. But I will tell you, here in our region, we have had a task force that meets regularly, monthly, of all community partners. You're talking about, dozens and dozens of community partners that meet to tackle this issue. How do we leverage our resources collectively to make a difference? And we're seeing some successes there. I think the next phase, at least from my perspective, is we've used grant dollars that we've gotten from the federal government to help fund this work. Over time, those dollars will go away. Fortunately, in our community, we're getting an infusion of funds from opioid settlements. And so what we're going to be working on is how do we bring the different governmental entities together to have their own respective pots of funds with opioid settlement dollars, and how do we strategically work together to make sure we're filling gaps and keeping the progress that's going on, irrespective of the funding source. So over the course of the next 10 to 15 years, there's going to be a flow of funds coming in with opioid settlement dollars into governmental entities that we can leverage to help move the needle on this, because as you all know, the opioid overdose crisis has evolved over the past several years. So we have to be nimble and adapt to it. So there's progress here, but we cannot let up. I want to comment about infant mortality rates, and I'll just tell you that ever since the beginning of our health department, and this has been a national issue, we've seen infant mortality rates generally drop across the country over the past 100 years. But there remains disparities in what parts of our community are more burdened by infant mortality than others. And these are some, in the past decade, you can see the trends for Jefferson County, where it goes kind of up and down at times. And in the past few years, it's slowly increased. And that's despite a lot of efforts, and I'll talk about some of that later. Now, some of the questions may arise, why are we still having excessive infant mortality? One of our partners, which is the UAB School of Nursing, runs a program in our community for Central Alabama, which is the Nurse Family Partnership. And reports from them say that for their clientele, and these are individuals that are at the highest risk, maybe the lower resourced, underlying what's driving that for their clientele are two main factors. And it is financial issues, poverty, and mental health. Okay? So despite a lot of energy and work, how do we fix poverty as a community? How do we address the gaps in mental health access? So these are deeper ways of approaching, we have to come up with solutions on a deeper level if we really want to make a difference, or else we're going to still have these disparities and we're not going to achieve health equity as we need to, right? So phenomenal work happening, but we're still trying to move the needle, and some things we can't move as easy. But we have to know what the data and information is showing so we can approach it very strategically. So in 2023, in the fall, the state health department, a part of their state health assessment, they call community conversations. They came into Jefferson County and they met with some folks here to assess what are the prevailing concerns in our community. And they issued this report not too long ago. In the supplemental report, they were looking at data, and one of the main issues that was brought up at that time was perinatal care. Okay? And I don't know how many people are familiar with that term, perinatal, but it's around the time before a child's born and sometime after a child's born. So you're talking about perhaps at time of conception, through the pregnancy period, and up to perhaps 28 days, it's debatable when you end it, that's the perinatal period. And concerns about are we having enough resources around our community about perinatal care. We know that there has been birthing centers here that in hospital systems that have closed down some of their operations. And so that impacts healthcare outcomes for that expected mother. Now, when they had this conversation, not only were they trying to have a conversation about perinatal care, but other things arose in those conversations. And one of the other concerns is, do we all have knowledge about how do we access resources related to perinatal care and other things? And then another thing that came up was community violence. So they started off the conversation about perinatal, but then these other factors that people are dealing with in their community has also arisen. Now, the Jefferson County Department of Health, every 5 years or so, we do our own local community health assessment. We are still compiling the results of this, but it was Your Opinion Matters survey. So, show of hands, how many people participated in the Your Opinion Matters survey? I see, wonderful. And the beautiful thing about this is that we've had well over 2,000 responses from you all to say, what do you believe are those leading health challenges? What do we need to really tackle? And so I will tell you, if you look at this really in-depth resource of data, and we're going to get the final report released hopefully fairly soon, combined with other conversations, I'll tell you, the opioid crisis has come up. In addition to the opioid crisis, mental health, public safety and violence. And there you go again at perinatal care. These are the emerging topics that we're hearing that the community is saying we need to tackle. And this is amongst a bunch of other things as well. And so we're going to strategize about how do we have a community health improvement plan to tackle some of these issues that we're burdened with. So this is, oftentimes when I do talks, I love showing this slide, one of my favorite slides. And when you look at this, tell me, you don't say it out loud, but what do you see? Who do you see? Because you should see yourself. The health department is just one governmental agency within this whole public health ecosystem. And everybody is involved in this public health ecosystem. Okay. Now, I have some health department employees here, so I need your help. I'm going to embarrass my people. I need your help, health department employees. Now, if everybody in this room is physically able to stand up, can you stand up real quick? If you're physically able to stand up real quick. And I'm going to need my health department people to help me, because you know what I'm about to do. They know this, and y'all are like, what is it? Okay. I need you to repeat after me. All right, I need you to repeat after me really quick. Okay. I am public health.
I am public health.
You are public health.
You are public health.
We are public health.
We are public health.
One more time, even more energy. More energy. I am public health.
I am public health.
You are public health.
You are public health.
We are public health.
We are public
All right,
health.
you can have your seat. Thank you. All right. Now, assuming you're not lying that you're public health. See, that's the setup. I'm going to pivot to partnerships, right? As this fundamental thing that we have to do to really move the needle on all these challenges that we have. Okay? So, effective partnerships really work when you have two-way communication between the partners. And really, it's about not only just collaborating, but coordinating what we all do. We need to pool our resources as partners. And if we do so, we can address any of these health challenges that we have. Now, with partnerships, that helps build the capacity of all of our organizations to respond to public health threats and emergencies. And they also need to be sustained, right? We need those resources to really help us move the needle. And that will help us have long-term impacts that we really need. Now, this concept of collective impact takes it, in my opinion, to another level. And we talked about this last year as well, right? So collective impact is not merely how do we collaborate together? Because we can be in the room, we can share what we're doing and agree to do some things together. But we have to be more effective of how we leverage the partnerships, because there's a lot of underlying social determinants of health that we have to really address and get to, or else we're going to see the same stubborn issues that we've been plagued with. All right? So, if we do this well, if we do this right, we should notice a few things. All right? Now, in order to do this, we have to engage with our community members, our community partners, to have shared decision making. It's just not those of us in agencies and institutions that are the ones who are the sole experts and the sole inputs on what we need to do. We need to actively engage with those that we're serving and put them at the table. The people who've lived experiences have to have a voice, not at the tail end of an intervention that we do, but on the front end as we're planning and strategizing how we do so. Okay? And if we do this collectively, we're doing this with a cultural sensitivity that is necessary, depending on whom we're serving. We need to have those diverse voices at the table to be more successful. This is really critical. It's vital. If we're going to have a really robust response to addressing these challenges, we have to do this with intent, under a common vision, a common purpose. A couple of examples of ways we've been trying to work together with some partners, okay? Now, in Jefferson County, there's a mental health roundtable, a group that meets regularly that talks about what are we doing in the mental health domain? Where are opportunities to leverage relationships and collaboration? On this slide, I have a couple of things I want to talk about quickly. All right, so the Confess Project of America, this is a program that UAB brought this opportunity into our community several months ago. And what this program does is it helps train the trainers that will go to barbers and hairstylists to be able to have open conversations about behavioral and mental health while you're getting your hair done. They may not be the mental health experts, but they're creating a safe space to have conversation. Now, when you have conversation, what do you do? Wouldn't it be phenomenal if you can then share resources to get help? So Behavioral Health 360 is something we're hoping that will be launched in Alabama soon. And this is self-help resources for behavioral health. Myriad of topics. What if you're dealing with anxiety, stress, bullying? You could be a student, a parent. We're hoping to bring this as a free resource to our community. So there's work behind the scenes, and then there's ability to have self-assessments there. So if you need to take it to another level, you can do an assessment. And then we need to then have an ability to connect you to local community resources, right? And so hopefully this is a seamless process. And so we can destigmatize mental health and behavioral health, have conversations, because data shows that 70% of people would like to do things on their own as self-help, because there may be stigma and they may not want to go into a counselor or therapist. So from a public health perspective, we believe that this may be at least our contribution to addressing some of the mental health and behavioral health challenges. This is not going to supplant the provision of mental health resources that we know we need even more of in our community. And then Connect Alabama is a platform that some people don't know about. It's already been produced. So you can download this app right now. It's with the Department of Mental Health at the state, and it has behavioral health treatment, substance use treatment resources, and they have it sorted by the county of residence. So we're hoping it'd be ideal if we can bring these all together so people have all the resources and tools they need, because remember that mental health was very high up on the list of what our community says that we need to be able to address. So although we're not a mental health agency, we believe that we need to elevate this into the public domain, and we're going to do our part collectively working with partners. Public safety. We've heard a lot about that. Gun violence, okay? Well, the health department has had this program, the Violence Intervention, Prevention, and Partners Program, in collaboration with the City of Birmingham and UAB Trauma Service. How does that work? Say you are a gunshot victim. You may have perpetrated the injury, or you may have been the victim. Either way, you've been injured. Traumatic experience. You need to get surgery. That's a really highly emotional charged environment at that moment in time. And we know that there's a cycle of retaliation of violence in our community. So what this program does is we have partners, the Offender Alumni Association, that will go there. They have lived experience, they know the criminal justice system, and they can have a conversation and saying, would you like us to give you some resources in a different way about when you leave out of this hospital so that you're not caught up in a cycle of retaliation, right? And they wrap their arms around these individuals. And this has been very, very successful. I will tell you that the City of Birmingham is going to be doing a similar type of a model. It's a little different than this. The health department's not directly involved in that, but they're going to expand this concept into the emergency department at UAB, right? And I think that may be more of a risky environment because, and this is my term, there's people that I believe are treated and streeted. You go to an emergency room, maybe you're grazed by a bullet, but you're not significantly harmed that needed operation. We don't want you to go out in vengeance. We don't want you to be a victim of now getting shot because someone says, I need to finish you off. So then an emergency department is another location to be able to de-escalate a situation and then get people the resources they need to hopefully put themselves in the best position to survive and then make those decisions in life that you need. Do we have gainful employment, right? How do you do conflict resolution, right? And that's leveraging partners that know the work because they have the lived experience and they can tell the story, okay? Based on a lot of that work, I believe that the mayor of Birmingham asked me to be a part of the Birmingham Crime Commission. I encourage everyone to read that, but it lays out from a public health perspective how we can address crime in a more global, broader way. This is community violence, I should say. And so that's one thing that we've involved with. Project Child Safe, this is a program in collaboration with the Sheriff's Office where we've been working about giving out gun locks last summer, and more importantly, in my opinion, doing safety education to young people. So if they come across a firearm, what do you do, right? And so we're hoping to keep doing that. The criminal justice reform with the Aston Institute, we're just a part of this. The beauty about this is that it's the Jefferson County leadership, City of Birmingham leadership has got together partners to really try to look at those underlying issues and drivers of violence. There's different data work groups. I'll just list out a few of them here. So the data work groups are crisis management operations, jail resource use and justice system case processing, neighborhood conditions and victimization, and then community asset mapping. From those perspectives, they're going to have to get the data to then help inform strategies to move the needle on a more broader kind of social justice perspective level. And that can help not only with gun violence, but a bunch of other issues. So I applaud our local leaders as tackling that issue from a more comprehensive way. Perinatal care, we talked about that before. There are a lot of efforts going on here. State Health Department has an Office of Maternal and Child Health. They provide funding to support a lot of programs, and certainly we want to make sure that there's adequate resources for the work that they do. The From Day One program is a program that we've had for years at the Health Department that really provides resources, education, and information for lower resource mothers in our community. I will tell you that in that program, we have extremely high smoking cessation rate. We have very high breastfeeding rates, and we have high vaccination rates of the clientele there. I mentioned the UAB Nurse Family Partnership before. They've made progress in addressing low birth weight in their clients, and working on preterm birth rates as well. So there's a lot of energy, but on the bottom right, you see the Maternal and Child Health Roundtable. Again, a collection of individuals and organizations all meeting together to strategize. And I'm just giving you a few examples of some of those. All right. Right now in the country, there's changes to public health. And we're all trying to figure out how that will impact any of us. In Jefferson County, we're not immune to those things. But I will tell you that in Jefferson County, and at least since the existence of our health department, we have gone through Spanish influenza, Great Depression, Civil Rights Movement, 9/11, COVID-19. So we have adapted and adjusted to no matter what was handed to us. Resources, lack of resources, county deficits in funding. But how we've survived all this time, it's not one, it's all of us have worked together. And this is the time that we have to be more intentional about working strategically together and partnering. Locally, we have the resources to be able to address these issues irrespective of anything else that happens around us. But we have to have intention. We're talking about that term collective impact. How are we gonna have a collective impact if we're not doing it together, meaningfully doing it together, sharing data and resources? So this is a call to action to all of us. But we can do this, we've done that. In order to do that, we need a strong public health workforce. And so I salute the public health workforce, and public health workforce is all of you. Remember, we are public health. Yes, sometimes there's pain points. That happens. But we are resilient. We have been resilient. We're going to continue to be that way. And we're going to still work to making Jefferson County the healthiest county in Alabama. So we have students in the room. I want you to embrace the field of public health. There's challenges, no matter what time period in society there is, but we need the smart, competent workforce to take the baton when some of us leave. There's always work to be done, and you are the best and the brightest. All right. So in my opinion, the state of health in Jefferson County is fairly strong. It's not perfect. We have things that we need to work on. But we're strong because we're strong together. We're strong because of you. So I appreciate you all. So now every year, the health department, we get the honor to give a public health champion, okay? So I need audience help, okay? I need audience help. Drum roll, please. Come on, audience. Give me drum roll, drum roll, drum roll, drum roll. All right. All right, the public health champion for 2025 is the UAB School of Public Health. All right. Now, Dr. Irwin, can you please come up here? Why the UAB School of Public Health? All right. He's not going to say it, but I'm going to brag on you and your team under your leadership. So, this is the award. All right. Here you go, Dr. Irwin. So, this is in recognition, a continued commitment to educating past, current, and future public health leaders, professionals, conducting impactful research, partnering with communities in Birmingham and Jefferson County and beyond to enhance health and well-being. So, the UAB School of Public Health has been established since 1978. You have awarded over 7,000 undergraduate and graduate degrees, and you supported advancements across the globe. Initially, you offered, I believe, graduate degrees, and then you had the bachelor's program of public health degree in 2013 with over 850 graduates to date. That further contributes to the public health workforce. In addition to those formal degrees, the UAB School of Public Health has enhanced the knowledge and skills of public health practitioners through the evidence-based public health course. You have trained our staff on evidence-based public health. So I really appreciate that. Now, the UAB School of Public Health is the only Council on Education for Public Health, CEF, accredited school of public health in the state of Alabama, and it is consistently ranked among the top 20 schools of public health in the nation. And this year, you even moved up a few slots already. So, in terms of public health workforce development, your school has received over $42 million in extramural funding through the 2023-2024 academic year. And that's informing public health practice, medicine, everything else. You've produced nearly 500 peer-reviewed publications, 70 impact papers, further advancing the practice of public health. Now, your students and faculty have also served our community very well. The students have provided over 48,000 hours of support to 178 agencies through their applied practice experience. Okay? So, given your decades-long role as a trusted advisor, supporter, and partner of the Jefferson County Department of Health, please join me, everybody, in recognizing the UAB School of Public Health as a recipient of the 2025 Public Health Champion Award.
Wow. Thank you, Dr. Hicks. Thank you, Jefferson County Department of Health, for this award. All of you in the room who are with the School of Public Health, will you please stand? You are public health. We are public health, right? This is collective impact. So thank you very much for this incredible honor, Dr. Hicks, and thank you for your words, your inspiration in describing the state of the county's health. You have given us so much to think about and to celebrate, even as we know that we need to work even harder on issues like mental health, public safety, and perinatal health. Thank you for talking about collective impact. Thank you for talking about the resiliency of the public health workforce. Again, thank you for being here today. Thank you, Dr. Hicks. Thank you, Jefferson County Department of Health. And thank you, UAB School of Public Health. So enjoy the rest of the networking opportunity. Thank you.